Hello, and thank you for choosing Santa Monica Center for Oral Surgery and Dental Implants.
We're here to make your healing process quick and easy.
Some common wisdom tooth post-operative conditions may include
difficulty opening the mouth due to muscle tightness and swelling, discoloration or bruising of the skin,
numbness around the corners of the mouth, lip, or chin,
sore throat with difficulty swallowing,
slight earache or aching in other teeth, dryness or chapping of the corners of the mouth, which may be treated with lip balms such as Vaseline or Neosporin ointment.
A slight temperature elevation up to 1.5 degrees above normal for a few days. Nausea may be related to pain medication or swallowing blood.
Discontinuing the prescription medication or reducing the amount to take 1/2 the fourth tablet may help.
Small fragments of bone may occasionally loosen and become exposed through the gum. These usually work out on their own, but if concerned, return to the office for evaluation.
If you have any questions, please do not hesitate to contact our office to speak with one of our assistants or your doctor directly. There is a doctor on call 24 hours a day, 7 days a week. First 24 hours after surgery include specific instructions for your health and safety. Please be sure to obtain information in your brochure in order to refer to.
Your doctor has prescribed an appropriate medication which should be taken as directed. You may also use ibuprofen or Tylenol instead of the prescription. If you're still experiencing discomfort while taking narcotic medication, you can safely take that with ibuprofen or Aleve only.
Warning: do not drive, operate machinery, or consume alcoholic beverages after taking prescriptions narcotic medications.
Swelling after surgery is expected and usually increases slowly, peaking at its maximum about 48 hours after surgery. To minimize swelling and relieve discomfort, apply an ice pack to the face over the areas of the surgery for 20 minutes on, 20 minutes off.
It is not unusual to have minor persistent or spot bleeding for up to 24 hours following tooth extractions. Bite firmly on the gauze placed directly over the site for 30 to 45 minutes, then remove the gauze when saturated. Repeat until the bleeding stops.
Be sure to remove the gauze when eating, sleeping, or drinking.
Should the bleeding continue, a caffeinated tea bag moistened in cold water may be placed in the same manner as gauze. Avoid rinsing your mouth on the day of surgery as they stimulate bleeding. When reclining, elevating the head with 2 to 3 pillows rather than laying flat will help minimize bleeding.
Do not rinse your mouth or brush your teeth after surgery. The following morning, you may begin brushing and flossing your teeth, avoiding the surgical sites. Also, rinse your mouth with warm salt water 3-4 times a day for 1 week.
You may drink non-alcoholic beverages immediately after surgery. However, chewing food should be delayed until numbness wears off.
A soft diet is recommended for at least the first 24 to 48 hours. Food should be cold room temperature or lukewarm. You may progress to a normal diet when you feel comfortable chewing.
Foods to avoid: spicy foods, crunchy foods, foods hot in temperature, popcorn, pretzels, alcoholic beverages, and seeds. Suggested soft foods: Gatorade, Jell-O, applesauce, high-protein shakes, fruit smoothies, ice cream, yogurt, oatmeal, cottage cheese, eggs, bananas, mashed potatoes, pudding, soup, tofu, and pureed vegetables.
Also, no spitting or sucking from a straw for the first 24 hours after surgery in order to reduce bleeding and discomfort.
48 hours after surgery, rest as much as possible and limit physical exertion for 2 to 3 days after surgery. Strenuous exercise should be avoided for 5 to 7 days. Smoking delays healing and increases the risk of complication. It is also advisable to avoid smoking for several days following the oral surgery. After the first 48 hours, you may apply moist heat to the outside of the face to help relax stiff muscles and reduce swelling.
Following your wisdom tooth extraction procedure, you may notice sutures on the surgical area. These sutures typically dissolve within 2 weeks. A follow-up appointment will be made in order to check on your progress.